Perfect. So thank you so much for joining the 2025 Fairfield Public Schools Open Enrollment presentation. My name is Elizabeth Roldan. I am the insurance broker, and IMAC Insurance is the insurance broker for the district. We handle everything from medical, prescription, and dental insurance benefits and can assist members with any enrollment questions that they have or claim matters. If you have any specific benefit questions, definitely feel free to ask that here during the call. But if you're watching the recorded version of this, feel free to give our office a call with any questions that you may have about your enrollment. Our office number is 973-450-9800. And members can also send out emails to us. We have an account called info@imacagency.com. And you can send us any questions you have about enrollment as well as any claim matters. We do a lot of claims advocacy for the district. So definitely we don't want employees frustrated with their plans if they're having an issue getting a prescription or a pre-authorization on a medical procedure. So feel free to give us a call and we will advocate on your behalf and make sure that we're working directly with the HIF and Aetna to make sure that your matters are resolved. So for this open enrollment period, uh, the open enrollment period began on April 15th and is ending next Friday, May 9th. There are no changes to the medical, prescription, dental, or vision plans. And as it is every year, open enrollment is your annual opportunity to review your plan options to make any plan changes. And Michelle, can you mute your mic because there's some
Oh,
feedback that's
yes,
happening? Yeah,
I'm
thank you. And
sorry.
then feel free to unmute it whenever you want to chime in. Thank you.
I sure will.
Um,
Thank you.
Thanks. And for any employees that were hired on or after July 1st of 2020, they are required by state law to be enrolled in either the New Jersey Educators Health Plan or the Garden State Health Plan per Chapter 44. So for those of you that were hired prior to July 1st of 2020, you do have 4 medical options that you can select from. You have the Aetna 10 plan, the Aetna 25 plan, and then the New Jersey Educators or the Garden State Health Plan. All of 4 plans are with Aetna, but we are going to be going through the differences for each of the plans. But we do like to highlight that for the Garden State Health Plan, there is no coverage outside of the state of New Jersey, whereas the Aetna 10, 25, and the Educators Plan do have national coverage. The Garden State Plan is just in New Jersey, in the Garden State. So unless you have a medical emergency outside of New Jersey, there is no coverage for that specific plan, the Garden State Health Plan. One of the questions that we got via email today and that we get asked frequently is how are contributions calculated? So for those of you that are in the Aetna Direct 10 and in the Aetna 25 plan, your coverage tier, so if you're covering a family with dependents, in single coverage, employee and spouse coverage, so your coverage tier is factored into that, your salary, and of course the premium of the plan. So for this year, there was a slight increase to the contributions for the 10 and the 25 plan, and those fall under what is called Chapter 78. So those 3 tiers, so coverage tier, salary, and premium, is how your contributions are calculated for those 2 plans. Whereas under the New Jersey Educators and the Garden State Health Plan, only who you are covering and your salary are factored into that calculation. Employees that elect the New Jersey Educators Health Plan or the Garden State Health Plan will definitely see a savings, a guaranteed savings, whether they're coming from the Aetna 10 or the Aetna 25 plan. But there are plan differences, and that's something that we're going to be covering in great detail today. Because the plans have to work for you not only financially, but they have to work for your medical needs for you and or your family. So we do like to go ahead and highlight those plan differences so members can make an educated decision to see what plan is going to work best for them. So some of the plan differences with the New Jersey Educators Health Plan and the Garden State Health Plan are as follows. The Educators Plan, so the New Jersey Educators Health Plan, that plan utilizes the same network of providers and the same prescription formulary for the Aetna 10 and for the Aetna 25. So if you're somebody who is in the Aetna 10 plan and you're considering moving into the Educators Plan, the providers that you're currently seeing in network are going to be exactly the same in the Educators Plan. So you will not have a disruption in network from that standpoint. However, if you chose to go to the Garden State Health Plan, that does utilize a different network within Aetna than the 10, 25, or the Educators Plan. So it is a smaller network that is used for that specific plan for the Garden State Health Plan. And as I mentioned previously, the Garden State Health Plan only offers coverage in the state of New Jersey, except in the case of a true medical emergency. And I always like to take the opportunity to mention that a true medical emergency is anything that is a threat to your life or a threat to the loss of a limb. So that's something important to highlight. The Garden State Health Plan utilizes the same prescription formulary as all other three plans. So from a prescription standpoint, you do have the same prescription drug coverage. But as we mentioned in the previous slide, contributions for the educators and the Garden State Health Plan are calculated as a percentage of salary rather than a percentage of premium. And the least expensive of all of the plans is the Garden State Health Plan because they use a different percentage table than the educators plan. But again, inherent differences there with the fact that you don't have coverage outside of the state of New Jersey and that the Garden State Health Plan does utilize a different network. For either the Garden State Health Plan or the New Jersey Educators Health Plan, it is a $10 copay when you go to your primary care physician, a $15 copay when you go to the emergency room, to your specialist, and then a $125 copay when you go to the emergency room, which is waived if you're admitted into the hospital. So you do have a slightly different copay structure under the educators and the Garden State Health Plan. And one of the big differences that we like to highlight is the out-of-network. The out-of-network for either the New Jersey Educators Health Plan or the Garden State Health Plan does function differently, and we are going to get into details with that in this upcoming slide. So in the New Jersey Educators Health Plan and in the Garden State Health Plan, you do have out-of-network benefits. In the New Jersey Educators Health Plan, that out-of-network is nationally. In the Garden State Health Plan, that out-of-network is only in the state of New Jersey. But when we speak about out of network, it's basically when you have a doctor that's in network, they are contractually obligated to only charge you for a specific copay. They can't bill you above that. But when you go out of network, that doctor, because they're not contractually obligated with Aetna, can really bill whatever they want. Aetna does approve what they consider usual, customary, and reasonable with the reimbursement that they provide for out-of-network doctors, but anything besides what Aetna allows is called a balance bill. So the reimbursement, we know for a fact under the educators and the Garden State Health Plan, they do reimburse less for out-of-network doctors. So the big takeaway here is that if you are someone who is going out of network on a regular basis, and we see this a lot with a lot of the mental health specialists, like if you're seeing a therapist on a weekly basis, that they tend to be out of network, or any other type of specialist that you're seeing on an out of network basis, you're going to get less money reimbursed under the educators or the Garden State Health Plan. And even though you are going to have a savings and contribution, that out-of-network additional cost may eat away at those savings. So it's important to see how you and your family are utilizing your benefits. For example, if you're going to a specialist maybe a couple of times a year that they are out of network, this may make sense for you to go ahead and make that move. But if you're going on a weekly basis out of network, that is a big red flag to consider before moving into the educators or the Garden State Health Plan. And just for example purposes, we put together this slide, just very high level. So if you're out of network under the educators or the Garden State Health Plan, let's say you go to an out of network provider and that provider bills a total of, let's say, $100. Aetna will go ahead and determine based on where that doctor is located and the CPT code of the service that was rendered, they'll determine that, let's say, that if that doctor would have been out of network, they would have paid $50. Aetna will then pay their 70% in coinsurance, and they'll pay $35. You as the member here in purple will pay your 30% in coinsurance, which is $15. And this $15 does accrue towards your maximum out of pocket out of network. But that other $50 that is still due to that provider that Aetna didn't even touch, or it hasn't been talked about until now, that is what is known as balance billing that is owed by the member in order to pay that provider's bill in full. So Again, $100 is a very small fee, but it shows to illustrate that there is a determination of usual, customary, and reasonable, and that you may have the potential of not only having a lower coinsurance reimbursed, but also a higher out of balance, balance billing that is due from you to that provider. So um, personally, what I recommend is that if you are going to an out-of-network provider, you can start even in Direct 10, in your Aetna 10, I should say, you can certainly ask that provider to give you an estimation of what your fees are going to be, to have an idea, so you're not going into it completely blind. A predetermination of services, really. But again, this is just an example to highlight of what out-of-network potentially can look like for you moving into the educators or the Garden State Health Plan. And just to compare the plans a little bit more in detail, as we mentioned, all the 10, the 25, and the educators plan, those all use the same network, which is the Aetna Choice POS2 Open Access Network. The Garden State Health Plan, however, uses the New Jersey Choice POS multi-tier network, which, as I mentioned, is a smaller network. It is a different network than in the other three plans. So again, something to strongly consider. Your copays, again, for primary care will vary depending on the plan. Same thing for your specialists. Your annual physical, which we always encourage everyone to make sure that they're getting their annual done, that is at no copay for all adults and children. And for women as well, your gynecological, that's included as part of an annual physical as well. And your labs are still the same in all four plans. You can either go to LabCorp or Quest. And depending on the plan, if you stay in network, you'll have no charge. But if you go out of network, you'll be subject to that plan's deductible and your percentage of coinsurance if you choose to go out of network. And in additional, all the plans have an in-network and out-of-network. They have limits with regards to your annual deductible. The 10, the educators and the Garden State Health Plan have no in-network deductible, which means at the moment the plan begins, it begins paying. Whereas, for example, in the 25 plan, you do have an in-network deductible of either $100 for an individual or $250 for a family. You do have out-of-network deductibles in all four plans, again, specific to that plan itself. And the deductible, again, is the money that you lay out before a plan begins. Whereas maximum out-of-pocket or out-of-pocket max is the most that you would lay out in a calendar year, which you have different limits in network and out of network. And as we were talking about out of network, this is for what Aetna considers usual, customary, and reasonable. So there could still be balanced billing when you go out of network in any of the plans that you may be subject to owe that doctor. But as we mentioned, in the educators plan and in the Garden State Health Plan, because they use a different table of reimbursement completely, you are going to get less money back for those out-of-network doctors under educators or Garden State Health Plan because of the different tables that are used. There are no referrals required for any of the plans. Outpatient surgery under all four plans is no charge in network and out of network. You're subject to your applicable deductible and coinsurance. And your emergency room copay is depending on the plan that you choose, but again, in all four plans would be waived if you are admitted into the hospital. Express Scripts is the prescription carrier for all four plans. And again, your medical plan dictates what prescription plan you're going to get. You do have a different copay structure, whereas in the 10 plan, it's a $10 for generic, $20 for brand, and $20 for non-preferred brand. Where, for example, under the educators plan, they do have a mandatory generic requirement where you do have to take a lower cost generic first, even if your doctor writes brand on the script. And the generic drugs under that plan are $5, and the drugs that are covered under what's called a preferred brand name status, that is a $10 copay. I know that Express Scripts put out, as part of their open enrollment guide that was sent out to everybody, their 2025 list of covered drugs. But again, if you're running into a situation where there is a specific drug that you need, please feel free to give our office a call and we can look into it and see why it's not being covered, or what's going on with that, why you're not getting the drug that your doctor requested. That's part of the claims advocacy work that we do. So next steps. If you are enrolled and you are not making any changes to your plans, there really is no action required on your behalf. But if you are looking to make a plan change or to waive your coverage, you do have to complete a form. We do have the forms on the IMAC portal, and I know Michelle also sent them out to everyone. We highly encourage you to also use the IMAC portal to evaluate all the different plan options. And again, review them as far as the coverage that you and your family may need, and as well as your contributions to make sure that financially the plans also work from you from that standpoint. We also have a link on the IMAC portal to do a search on Aetna's website if you're looking to compare the provider network. Let's say if you're in 10 and you're looking to go into the Garden State Health Plan and you wanted to see what those providers look like, that's an option. But as we said, if you're coming from the Aetna 10 plan to the New Jersey Educators Health Plan, those network of doctors are exactly the same. So no disruption there. And please note that you are selecting a plan for the 2025-2026 school year, and you'll be eligible to switch plans again next May of 2026. The deadline to make any changes to your benefits is next Friday, May 9th. And please make sure that you are returning those forms to Michelle in the business office. The IMAC portal, it is the same login for everyone. If you visit imacbenefits.com, it'll prompt you for what's called a guest key, and it is all in caps, FBOE, Fairfield Board of Education. And on there, you'll see everything related to all of the plan documents, comparison charts, information about prescription, health and wellness links, the Chapter 78, Chapter 44 calculator. So we have all of that and all the forms as well. We have all of that, so it's one-stop shopping for all of your benefit questions and forms that you may need. Again, this is the form that is due back to Michelle on May 9th if you're looking to enroll for the first time or make any changes to your enrollment. Something that we like to highlight during open enrollment, since it's a great opportunity to connect with all of you, is Chapter 375. So in the state of New Jersey, there is a mandate. If your dependent child is over the age of 26, they may be eligible to stay on the same plan that you're on until the age of 31. There are some requirements that the state has, which is that it has to be that your child has to be unmarried, have no dependents of their own, live in the state of New Jersey, or are a full-time student at an accredited public or private college, and that they're not covered in any other group plan or are entitled to Medicare. We mentioned Chapter 375 or dependent over 31 because it is a less expensive plan, cost, I should say, than going COBRA. COBRA charges 102% of the premium, whereas dependent 31 or Chapter 375 coverage I believe it is 65% of the premium. So it is significantly less. And it's only eligible for those dependents that meet these requirements and only for medical and prescription. Dental and vision is not part of that, but again, something that we like to highlight in case that's something applicable that your child may be aging out. We do have a link about this very topic on the IMAC portal as well. We also have the new calculator on there, which is being posted today, actually. But you will see it there. You will need Excel 2013 or later in order to utilize it. But if you have any questions about what your contributions would look under your Aetna 10 versus the educators plan, give our office a call. We'll run those numbers for you and let you know what your costs would be under the various different plans. We also want to remind everyone that you do have that Aetna Fitness Benefit program available that if you go to the gym, it's eligible for you and your spouse to get reimbursed for your gym memberships. And again, depending on how many times you go and all that. So we do have that form also on the IMAC portal. And with that said, that really brings us to the end of our presentation. I'll open it up for any questions or anything. But I think the big takeaways for today are, your May 9th deadline to make any changes, and please make sure that you're communicating those changes back to Michelle by the 9th. And of course, this is our information of how you can call or email our office. And we are getting back to members pretty much within hours of their emails, just to make sure that they are getting the responses that they need on a timely basis to make their open enrollment decisions before the deadline. Michelle, Katie, did you guys have anything else that you'd like to add before we wrap up?
Elizabeth?
Hello.
Yes.
Just a quick question. Chapter the 375.
Yes, I'll go back to that slide.
Yes. If I have an employee that has an aging out dependent, we go through BMED. I would need to let them know that we would like to activate the chapter 375.
Yes, there is a form. The member would complete it, and
Okay.
then the billing is then handled directly from the carrier and or the HIF with
Okay.
the member and the child. So the district won't be collecting any more payroll contributions because
Right.
they'll be dealing directly with the HIF on that. Yeah.
Okay. Handle directly. This
Yeah.
is important because a lot of times we're going through the BMED, and I think the cost is a little higher.
Oh yeah.
Yes.
Oh yeah. I mean, Cobra is very expensive. Every time I speak to a parent that has a child that is aging out and has Cobra, immediately they're like, "Oh, is that the annual fee?" And I'm like, "No, that's the monthly fee."
That's the monthly.
So people they do get they do get sticker shock because Cobra is incredibly expensive. Chapter 375 is great in the state of New Jersey, but again, your child does have to meet these requirements.
Yes.
And depending if your child may be, having a medical situation that they need to stay on this plan, it's important because, the coverages that are available, for example, on the government marketplace under the Affordable Care Act, those plans are nowhere near as benefit rich as what you have here through Fairfield. So,
right.
And they're expensive. I just looked up a plan for someone, a single 30-year-old dependent child of an employee that they were going to be able to get an Omnia Silver plan, and it was $772 a month, and it had no out-of-network benefits, a major, I think a $1,500 deductible. So yeah, they're nowhere near as benefit rich as what you have through the district.
Wow, Jesus.
Yeah.
Elizabeth, can you go back to that last slide for a second? The one with the gym membership? Oh no, right before that, I guess.
Yeah.
Okay, spouses for 100. Okay, I never knew that.
Yeah, you know what? Open enrollment, we love to throw everything but the kitchen sink in there because, throughout the year, we don't get enough time to connect with members one-on-one. So we want to make sure that you're getting the most out of your benefits.
Yeah. Michelle, do you have those forms in the office?
We have them on the portal as well, by the way.
Website.
Okay.
Yeah.
Liz?
Yes.
I believe we have this posted on our district website too, unless the form has changed. I believe that I have our IT guy post this information on the district website. Yeah.
Perfect. Any other questions, ladies?
And you're saying that the new calculators are available?
It's we're putting it on tonight. What we'll do is we're going to put on this recording tonight because it'll be generated within an hour of us ending the meeting. So what I'll do is I'll share the link with you, Michelle, so you can share it with everybody. We'll also post the link and the updated calculator on the portal as well tonight.
And I'll kind of like catch up with you further.
Yeah.
With my calculator is usually a little different.
Yeah, no, not a problem.
Thank you.
Perfect.
And I have just one more question. So obviously, I think it's obvious, but like when you switch over, so like I'm considering going from Aetna 10 to the EHP, and that would be all four, like medical, dental, prescription, vision, all four, right?
Dental and vision aren't affected by those changes, but it'll change your, you'll get a new card to reflect your new medical plan and your new prescription plan. Yes.
Okay. And then the vision and the dental just stays the same.
That stays the same. Yeah,
this
those
doesn't
are,
affect that.
yeah, those are completely standalone.
Okay.
Liz, I want to, I'm not sure, is Express Scripts, I think they're no longer sending out cards.
Yeah, that's true. Because I just had logged into Express Scripts and there was
Uh-huh.
like a little notification that said like you can print your own card, but they're not sending them out anymore.
Yes.
Gotcha. Yeah, you know, it's interesting. I personally had a switch on my plan, and I was blown away that I went to my pharmacy with my new card, and they're like, "Nope, we got it already."
Wow.
So I guess they communicate it to CVS.
Yeah.
Well, in my case, my plan, we're in Aetna now, and I guess because CVS is owned by Aetna, that makes sense.
Oh.
I didn't know that.
Yeah,
That's good to
CVS bought
know.
Aetna, yes,
That's good
about
to know.
a
That's
year
why
or two
they
ago.
have my information. Okay.
Yes.
Okay.
And I think I just want to go back for 1 second. Speaking
Sure.
of Express Scripts, about the like mandatory, yeah, it was on that page about the mandatory generic first.
Yeah,
So
so for example, if you are someone that is on Crestor, which is a brand name medication for cholesterol, the
okay.
pharmacy under the educators or the Garden State Health Plan is going to dispense, I believe it's a Torvastatin, which is the generic. So, so if you have a brand name drug that has a lesser expensive generic drug available, that's what's going to be dispensed. And that's something that we like to highlight to members, just to make sure that they have a full understanding of that. But there are brands that are covered. So like, for example, Ozempic, which I know is a very popular drug right now, that is covered under the educators or the Garden State Health Plan. You obviously have to meet certain criteria in order to be on a drug like that. Like you have to have a diagnosis of diabetes and other comorbidities. So you do have prior, in certain drugs, whether you're in 10 or whether you're in educators, you definitely are going to have prior authorization required, just because they want to make sure that you have the medical necessity. Yeah, exactly. But
so like
yeah.
my daughter's going to be receiving Xolair allergy shots. Do you happen to know if that would be covered, or I could send you an email privately if that's better, if you don't know it offhand?
No, what I will say is that that would fall under the medical plan. Any prescription is anything that you yourself are ingesting or injecting to yourself, but the allergy shots like that, that would be covered under your medical plan.
Well, they said that it comes through Express Scripts because we administer it to her at home.
Oh, so you're administering it to yourself. So yeah, so I can certainly look that up for you. Well, send me an email. You have my email address. I can look that up for you. Yeah, that's not a problem.
Okay, cool. Thank you.
Would that be on that list, Liz, or no?
It would be on that list, but you know, just to double check, I would like to send a message. You know, and that's important. You know, we've been not only here at Fairfield, but at other districts. You know, I've had actually members send me a list of the drugs that they're on, just to make sure that they're covered. That's an important thing that you want to make sure before you're making a plan switch, that you do your due diligence. So absolutely, that's great.
That is important.
Yeah. Perfect.
Okay.
Any other questions?
Have any other questions. No, that was very helpful. Thank you for laying it all out. And I did go on the site earlier today and looked at the comparison chart, and I'll do the calculator. I'll wait for that tomorrow and look at that. Yeah, side by side, and see cost wise what the difference is. But just speaking to a couple other staff members who have switched, they were like, I have not noticed any difference except for in my paycheck.
Yeah, no, the savings are guaranteed.
Yeah.
You know, and the higher you are salary wise, the more significant savings you're going to see. And what's great about it is that at most you're committing for a full year. So, you know, if by this time next year you feel that, hey, maybe I laid out a little too much out of network or on certain prescription drugs than I wanted to, you can switch back. So that's the beauty of it. Yeah.
Well, she can switch back because she's grandfathered in.
Because she's grandfathered in, exactly. But you know that in another district that I'm working with, there was a bit of a misconception that if you left your 10 plan, whether it was Aetna 10 or your direct 10, that you couldn't go back to it. And everything is determined by your date of hire. So as long as you were hired prior to that July 1st, 2020 deadline, you can switch back and forth with any of the plans that are being offered in the district.
And Cody, I switched over as well.
Okay. Yeah.
And you've had a positive experience, Michelle?
Huh?
And you've had a positive experience, Michelle?
I have.
Excellent. Yeah.
Yeah, I haven't had any problems. So, unless I get severe, problems, then
Right.
I'm paying the educators. Yeah.
Yeah, and
Yeah.
like I said, the educators plan, you have the same national network that you have
Yeah.
under the Aetna 10. So if you wanted to go into New York City to go to, Memorial Sloan or any of the big hospitals
Yeah.
there, you have that ability under the educators plan because it has national coverage.
Right. Okay. All right, great.
Perfect.
Thank you so
All right.
much.
Absolutely. Thank you, ladies. Have a good rest of your day. And again,
Well,
feel free to call or email our office. And Katie, I'll wait to hear from you on that email.
Okay, sounds good.
Great.
Thanks.
Thank you,
All right.
everybody. Have a good night.
Bye-bye.
Bye bye.
Bye-bye.